In this video, I'm going to talk about pharmacotherapy in pediatrics. So first, what is pediatrics? Pediatrics is a branch of medicine treating the kids or the pediatric age groups. Who are they? Who are the pediatric age groups? Maybe you think it's just kids. No, they are not just kids. Pediatrics is divided into 7 groups of children. Here, we are going to discuss their age. First, premature newborns. These are the newborns delivered before 38 weeks of gestation age. As we said before, they are called preterm or premature newborns. So this is the first group. The second group, they are term newborns. It means they are born after 38 weeks of gestation. They are called full-term babies. Group number 3, the neonates. The neonates, they are the children from 0 day to 30 days of age. It means sharply the first months of life. Group number 4, they are the infants. They are from 1 month up to 2 years. Group number 5, the young child, from 2 to 6 years. Number 6, the child from 6 to 12 years. And then group number 7, they are the adolescent from 12 to 18 years. A very famous hospital worldwide called SickKids in Toronto is treating all these groups. This hospital is very famous. Caring about pediatrics. What is special about pediatrics in pharmacotherapy? Pediatrics, they have special routes of administrations we should think about. They have different pharmacokinetics and they have different pharmacodynamics. So in this video, I am going to talk about these 3 topics, which is important for us as a medical team, either a doctor or a pharmacist, to understand the difference in these topics related to the pediatric age groups. So first, let us discover the routes of administration. Routes of administration means how we deliver the drug. The drug can be delivered in many routes. Number 1, oral, taking by the mouth. Number 2, buccal, it's inside by the cheek. Number 3, rectal. These 3 routes, we call it the enteral. Enteral means it passes through the intestine or related to the enteric system or the intestine. Okay? Next is the topical route, which is a cream or eye drops. And then the parenteral group, which means giving the drug intravenous, intramuscular, or subcutaneous. Why I marked these 2 terminology with red? Because parenteral means it is not enteral. It means not related to the intestine. We give IV by a needle or IM inside the muscle or subcutaneous under the skin. So these drugs does not pass through the intestine by the oral, buccal, or rectal route. Okay? Next is the nasal group, nasal route of administration through inhalation. The respiratory, we are going to discuss the MDI and we are going to understand what is it. And the nebulizer, respiratory group contains the MDI and the nebulizers. So I'm going to show you a table, and according to each route of administration, we are going to know which group of pediatrics is best taking the drug through this route. Regarding the oral, which is the most easy, of course, is the easiest way and not interventional. Generally, suspension, syrup, and drops they are liquids. So liquids, they can be easily administered to all groups. As you can see, suspension is suitable for all groups, starting from the neonates. Syrup, of course, it's suitable also, and drops. So liquid form is good for all age groups. Suspension, as you know, it is the drug suspended in the liquid. It means it is not dissolved in the liquid, and you have to shake well before giving the dose. The syrup, it means it has a sweet taste, usually orange or strawberry flavored. So the young child and infants, they like it. And the drops, it's very simple. Regarding these three routes, these three drug forms, granules, tablets, and capsules. Granules may be given from the infant age, but I think it's better to be avoided. Tablets we can give from the young child, but also it's not preferred. And capsules should be given only from the child and adolescents. It means starting from the 6 years, because sometimes it's hard for them to swallow the capsule. Okay, next is the Baca route. Baca route also starting from the child age. And then rectal or suppository and enema, they can used by all age groups. Topical on the skin, of course, all ages. And then regarding the parenteral, they are suitable for all age groups regarding the intravenous. Intramuscular is not preferred in the neonate age group, and subcutaneous is suitable for all ages. The nasal, we can give it from the infant age. The MDI should only be given for the child, and the nebulizer can be given for all age groups. These three routes, the nasal, MDI, and nebulizer, we are going to discuss in details. Why? Because bronchial asthma is a very common disease in the pediatric age group, causing respiratory distress. Also, what is the danger of respiratory distress, especially in the young children? Because it affects the growth and development of the child. If the child cannot breathe well because of the bronchial asthma, he cannot get enough oxygen, so he cannot grow up effectively. So it's very important to strongly control and treat bronchial asthma in pediatric age groups. How we do this? We have two strategies. Control of the acute attacks by the relievers or bronchodilators. These are group of drugs called the relievers or bronchodilators. And in between the bronchial asthma attacks, we have to control the inflammation, ongoing inflammation, by controllers or anti-inflammatory drugs, which may be steroidal or non-steroidal. Again, I want to stress why it's important to treat bronchial asthma, because it's a respiratory emergency. Sometimes during the attacks, the child cannot take his breath and they may die. So it's very important to know about bronchial asthma in the pediatric age groups. How we deliver the drugs? We have the most famous device called the metered dose inhaler. Metered because it's measured. Dose. Inhaler, this is the device. And we abbreviate it as MDI. I think most of you have seen this device. However, this device needs coordination between hand and breath. When you have the device, first you shake it, and then you should teach the child how to press and inhale at the same time. And after inhalation, the child should stop breathing for a few seconds to allow the drug to enter the lung. This action sometimes hard for a child to make, and sometimes the drug is not delivered correctly. So, in this condition, we add another device called the spacer. What is the idea of the spacer? You deliver the dose from the inhaler in this space and then put the other end, the mask, on the face of the child. So you deliver the dose here and allow the child to slowly take breath and deliver the drug. As you can see, it requires no coordination and it's cheap and portable. You can take the spacer and the NDI anywhere you go. Of course, this is a good method, but the ideal method for drug delivery is the nebulizer. Nebulizer is a machine which delivers the drugs with oxygen into the face mask. Just the child put the face mask on his face and he can breathe quietly as he likes. However, the advantages of the nebulizer is it requires no coordination. You can add mixture of drugs and there is any airflow level. You can have low airflow or high airflow level regarding the rate of breathing of the child. But as you can see, it's a device, big one, it's expensive. Not all families can afford to buy the nebulizer, and it's not portable. It's hard to take it outside home. Usually, the nebulizer is bought by the families whose children have frequent attacks of bronchial asthma. And of course, it's always there in the emergency unit in hospitals. Okay, so that was the first topic.